So yes, of course. NERLYFE was a phase 4 trial looking into the safety of neratinib in HER2-positive early-stage breast cancer patients who have completed trastuzumab-based therapy. You know that in EMA Europe, neratinib, second-generation HER2-directed TKI, is approved for extended adjuvant treatment in patients with hormone receptor-positive, HER2-positive breast cancer who have completed trastuzumab-based treatment. They need to start neratinib within 1 year from the end of trastuzumab-based therapy. And this approval, of course, was based upon the phase 3 extended trial, where the addition of neratinib has reduced recurrence rates. But there was one big problem here in clinical routine. That was a high rate of grade 3 diarrhea, which is typical for this type of drugs. Second question, of course, was that in extended, all the patients had only received prior trastuzumab, but in these days, usually trastuzumab and pertuzumab are being administered in the neoadjuvant setting and TDM1 in non-PASTA patients in the post-neoadjuvant setting. And we simply don't have any data here regarding the activity and safety of neratinib. Now, the primary endpoint was the compliance with neratinib, and the trial really aimed at finding options of reducing the high-grade diarrhea rates here. And in principle, two options are available. One is a mandatory antidiarrheal prophylaxis, and the other one is a slow increase of the neratinib dose. And especially with the latter strategy, we have seen that the grade 3 diarrhea rate is definitely lower. There is good compliance, a low rate of patients discontinuing treatment early. So with that strategy, obviously, neratinib can be used in the clinical routine.